Hi everybody, I'm Dr. Joseph Cipriano, and today we have here, actually he's a little bit into everything with like nutritional coaching, personal training, just, I mean, you're kind of hitting every aspect of the fitness realm. First off, one that I want everyone to see, dude, can I get you to stand up?
Yeah, of course.
All right. As you can tell, he's just a smidge taller than me.
He's got a little bit of height right there, yeah.
Yeah, no, 6'5", so definitely a very, very tall guy.
Yeah.
As you can tell, great physique. You know, he practices everything he preaches. So, why don't you get into, let everyone know like your Instagram. Just give a little background about you.
Yeah, sure. So my Instagram is at Eric_McAvoy_. I do a lot of fitness-related posts, kind of teaching the beginner basics. I'm very into flexible dieting, and so that's creating a diet around your lifestyle and not feeling stuck to a meal prep or doing keto or anything like that. Because my whole view is you're supposed to enjoy life and live life to the fullest, but also be healthy while you're doing it. And so my goal with the whole Instagram is to teach people how to live a better, healthier lifestyle while enjoying the foods they eat. So your diet doesn't have to suck. Basically, that's what I do.
That's a good thing.
Yeah,
definitely something that I'll be kind of joining in on because I could always shed a few pounds here. Life definitely gets in the way with everything, and you just need someone like you to kind of keep me on track with things. Very simple to get off track with. Especially with eating or meal prepping, just anything in the general. Yeah, and the biggest thing that I've found is just finding what works best for you, because what works best for me might not work best for you, and it's finding the balance between sustainable and optimal. So we want something to work well, but we also want it to work for you and your lifestyle and what you enjoy. And so it's being able to combine those two and finding the best thing for each individual person. That's really what I'm passionate about, and getting people to live their best lives through fitness and nutrition. Perfect. Yeah, and with me, with chiropractic, adjustments, we want to keep, you in general, your fitness in tip-top shape. We want to make sure, our muscles are balanced, that he's not kind of sustaining injury due to, any type of spine kind of defects going on. We just want to make sure that we want to just keep everything aligned. So as hard as you do want to work out, we don't want you to injure yourself.
Exactly, yeah.
So now
longevity, right?
Exactly.
Yeah.
Now today, I know you were telling me a little bit earlier you had more low back pain.
Yeah.
Okay.
Yeah.
So what's going on with that?
It's just been, every morning when I wake up, it's kind of stiff. Sometimes bending over to put on shoes bothers me a little bit. It's nothing that really alters my life too severely, but it's something that I've had for, I guess it's 9 months now. It's something that I feel is just a part of everyday life, and I know that doesn't have to be. No. And so that's one of the reasons I came here, is to see if we can fix that and I can go back to living, without that little daily aggravating pain.
Gotcha. And now one thing that I know you have been to other chiropractors before, other even massage therapists. So he was told that it's more of a piriformis type injury, and it's more of a bilateral piriformis injury. So we're going to see, at the end, after the adjustment, I'll give you a couple of piriformis stretches to do that may help as well. But definitely, just to try all our different avenues and, get you back to 100%. Yeah. All right. So I'm going to have you first. I'm going to have you lay face down for me.
Sure.
Okay. All right. So as everyone knows, whenever I, start off to do an adjustment, I am going to scan the entire body. We're going to scan the spine. We're going to see, the muscle imbalances. We're going to come in. We're going to palpate the spine. As what palpating means, what that is I'm feeling it. I'm feeling the muscle tonicity. I'm feeling everything, the symmetry. I want, you want your left side to feel as it does on the right. So I'm going through a little bit of tension actually right here on the left side compared to the right. So little things like that as I'm coming through. For once, actually not too, traps are very loose, which surprisingly a lot of people do hold a lot of their tension in their traps, so that's a good thing for him. And we'll come down. We're getting a little bit of tightness around the mid back, and then we'll come on down into the low back here. So now the low back, this is the problematic area that he's been having. Any pain when I push down on the right side? Any pain when I push down on the left side?
Nope.
Any pain over the sacrum when I push in?
Nope.
Good. So when we come in through here, any issues there?
Nope.
Good. So no pain in what I was doing. I was feeling through the lumbar spine. I was feeling over that right SI joint and the left SI joint. Now, areas where you may be feeling pain, any issues through here?
No, not really.
Not really? Okay. What about through here?
Nope.
Okay, good. So this is more of the piriformis area. So we're going to do a couple tests and we'll see exactly if it's more that. But another thing, so when I come back and come down from here, you know, I scan the body, and as you can tell, we have a little bit, very slightly kind of going to the right side here. Another thing that we're going to look at, so I'm coming down at the feet and ankle. Now here's a big difference. So if you want to come in with this one, definitely something we see here. As you can tell, this left side, and I mean here, I can push on in with his feet. His left side is quite a bit shorter than his right. So this is one thing that is definitely noticeable. Okay, but as what I like to do, I like to start all my adjustments up at the top. We're going to start up here, and then we're going to make our way down, and we'll get to, obviously that left side is really what needs it the most. Okay. So not much tightness up in here, more a little tiny bit compared to the T1. And we'll come here. Good. I know you felt that one. We'll drop a little bit lower on that right side here.
Ooh, yep, felt that.
Good. So I just want to make sure, keep everything real nice and aligned in through here. We'll do that mid-thoracic. Take a deep breath in and exhale out. Good. One more time, deep breath in, exhale out. Good. Okay. So now we're getting down into the low back and the sacrum area. So this is the main thing that we want to focus on here. So what I'm going to do, I want to put pressure down on your sacrum, and I want you to raise one leg at a time, but I want you to raise your leg from here, like this for me, okay? So we're going to put pressure on the sacrum, raise that left leg up as high as you can. Any pain, tenderness, tightness with that?
Nope.
All right, relax that side. Raise the right side up as high as you can. How does that compare to the other side? Was any easier than the other?
Yeah, slightly easier, yeah.
Which one?
The right side.
The right one was slightly easier. All right, so what we're going to do, I'm going to have you cross, that left over the right. So what's happening here? So let me grab the spine. Let me show everybody at home what's happening. So the sacrum here is starting to point more towards that right side. So when it points more towards the right, the muscles and ligaments on that right side are more lax. They have more laxity in the motion, so they're able to let that leg raise up higher. Now you got to realize, if you see everything pointing to the right here, to the left, everything is taut and tight. So what's happening is it's making it harder for him to raise that leg up. Now granted, obviously he's in great shape, so for him, he's still able to lift that up, but he just noticed that it is easier on the right side compared to the left. Sacrum is pointed this way. We want to do a clockwise torque because we want to bring it back towards that left side. So the table is going to drop down below you, okay? So I go. Good. And I'm going to have you uncross. Bend this leg for me. Yep. And one more. There we go. Okay. So now what I want you to do, I want you to raise this left leg up for me. Notice any difference?
Yeah.
Okay.
Yeah, it's definitely a little bit easier now.
Okay, so a little bit easier. So that was just with the sacrum. Now what I want to do, we're going to do a little bit more on that left side because I'm not convinced it's 100% better. I am going to have you lay on your side and face me. Good. So we're going to relax. You're going to kind of lay on your back a little bit there. Good. I'm going to have you bend this knee. roll you this way towards me. There we go, we're already perfect. Already hearing that move just with almost getting you in setup there. Now I want you to flip, we're gonna bring you to the other side. Yep, and we're gonna do the same thing. Gonna roll him over, good. Good, there we go, got a lot of good movement. I'm gonna have you lay flat on your back now. Perfect. All right, so now we definitely got some more movement in the in that low back after that. So we did the drop on the sacrum, so we worked on the sacrum. We did also a little bit of lumbar work as well. Now what I'm gonna do, I wanna work a little bit more. I wanna do leg pull on either side. So with the leg pull, he may feel that adjustment in the knee going all the way up into the hip as well. Good. Good. How'd you feel with that?
I felt that in the knees.
You felt that in the knees too? Yeah, you feel that literally if you work up through the chain with how I'm pulling, you know, you could feel that in the ankles, going into the knee, and then going into that hip as well. So those are, you know, some of the main areas, you know, that I want to work at with you. So one thing that I do want to see, we're going to have you sit up. I want to make sure, I want to clear out the rest of the thoracic spine. Okay, so I'm going to have you give yourself a big hug here. Good. Okay, take a deep breath in and exhale out. Okay, I'm going to go up a little bit more, so come up just a little bit. Perfect. Deep breath in and let it out. Okay, that was nice and cleared out. So what we're going to do now, we're going to use the Y strap, so you can relax your arms for me. Okay. So everyone who maybe has not seen the Y strap, what this is a manual decompression. So it's going to go around the head, it's going to wrap underneath the occiput, and I'm going to do a Y-axis distraction so we can just open up all the joints, okay? And have you lift your head up. Good. Perfect. Distract him up.
Oof.
Now, have you ever had that one before?
No.
No? A little bit different, huh?
Yeah.
You feel how
definitely
that,
felt it though, yeah.
Yeah, you feel how that just opened everything up. So the first time I do it actually rather light because it was the first time you've ever had that done. I don't want to shock you too much. Yeah. But yeah, throughout care, I'll start using a little bit more force that's really going to just pull apart. And I mean, I know how you felt that go down the spine.
Oh yeah.
How far down did that go with you today?
Just about to my shoulders.
Okay.
Yeah.
Okay, yeah, I went really light, you know, technically, as a bigger guy, more in shape, I probably could have used a little bit more force, but even just that little bit, I know that you'd really notice with just that one. But yeah, so now we can go through, we can feel the neck, see how this is feeling. Not too bad. So what I'm doing, when you guys see me like this and like this, I'm laterally flexing the joints on either side. I'm trying to feel between lateral flexion, a rotation on either side. I'm just trying to feel how the joints are sliding from one vertebra to the next one below. So I'm feeling just a little bit, but he's got a lot of lateral bending and flexion with him, so yeah, we already got that cleared out, which is a good thing with that Y strap. So that was really good with that one. Okay. So now what I want to do, I'm going to have you sit on up.
Sure.
And what I want to show at home, I do want to go over two things. I want to check the leg length again, see how that was balanced out. And then I do want to just show a Piriformis stretch.
Sure.
So I'm going to have you lay face down for me. Okay. All right, so having him lay face down now at the end of the adjustment, If you guys want to take a look, yep. How does that look now, this time? There's definitely quite a bit of a difference this time than there was last time. So we're definitely seeing now, with having the legs balanced, these are issues that can help with, with the Piriformis. So I do want to show you guys a stretch at home, what I normally have patients do if they do complain of Piriformis type injury. I want to have you just take a seat. And you can faces. Yep. And with this one, cross one leg over the other, and then literally just bend, flex your entire body down like that. Now, when you're flexing down, where do you feel that pull?
Very, very deep right over here.
Very deep right over there. So that's working. As you can tell, his left knee is flexed. That's a very good stretch to do. If you do feel that it's a Piriformis type injury, that's a great one. It's easy to do. I know granted he's in great shape, but you don't have to be in the best of shape to do this one at home. Very simple, very straightforward. Yeah. And then if you want to switch and just show everyone the other side too. Yeah, and then just coming straight down. And you feel that one also as well, right? Mm-hmm. Good. So these are techniques that are helping stretch the Piriformis, and then you can relax. If it is 100% certain with the Piriformis type injury, those are great stretches to do at home, but I definitely recommend at least coming in or going to your local chiropractor, checking, having them give their professional opinion, running through orthopedic tests, and just overall, just checking the body to determine whether it is, a sacrum, a lumbar, an SI joint. There's so many different issues when it comes to the low back that you have to focus on. Mm-hmm. Okay. So now, how are you feeling after all that?
Good. Feels looser.
Feels looser? Yeah. Good. So I know now I'm going to have all his information, Instagrams and everything all put in the description of the video. So if you guys, wanted to reach out to him, I know with the nutritional coaching and with that, with fitness, working out, just, check him out. As you can tell, he practices what he preaches, so, definitely in great shape. If anybody does want any, motivational type things, he told me every morning?
Yeah, every morning I try and pop on there and do something motivational. And then, I forgot to mention, but I actually do co-host a podcast.
Okay.
It's called the Positive Mindset Podcast, where every week my co-host Henry and I, there's a new topic of something that we've come up with in the past week, and we try and show how, what your mindset is focused on, how that can affect how you react to certain different situations and different challenges life will throw at you. So.
Perfect. Yeah, I'm definitely gonna have to check that one out as well too. But yeah, so we're gonna get everything listed, and so if you guys like the video, definitely like Eric, please follow him. Let's help him out. Let's grow his channel and see. As you can tell, I probably mentioned it like 3 or 4 times, but as you can tell, he practices what he preaches. The results are there. So what he is doing is working. But I'm Dr. Joseph Cipriano. Have a good one, everybody.